So thank you so much for being here this afternoon. My name is Ann Cheney. I am faculty in the School of Medicine in the University of at UC Riverside in the Department of Social Medicine, Population Public Health. I do see that our presenter is here, so I'll introduce him in a moment. This series is part of a larger project that's well-being in Latinx and Indigenous Mexican communities with a focus on the Purepecha community. You'll learn more about the Purepecha community in today's presentation. Today's presentation is Cultural Connection, Strengthening the Medical Provider-Patient Relationship, and it will be presented by Benjamin Perez, who is a medical student here at UC Riverside in the School of Medicine. And again, this is one of a three-part series that's focused on the patient-provider relationship and understanding how we can increase the capacity of medical providers to provide culturally and structurally competent care for Latinx and Indigenous Mexican patient populations. And I'll hand it over to Benjamin.
Thank you, Dr. Cheney. Just first of all, can everyone hear me? Is it working properly? Or
It's a little muted, Benjamin.
okay, is it better now?
A little bit better.
Okay, I'm also going to speak louder then. Well, as Dr. Cheney was saying, thank you for the introduction. And yeah, my name is Benjamin Perez, and I'm currently a second year medical student. Sorry, 1 second. We seem to be having a little bit of um, difficulties, technical difficulties. Sorry. Now, can anyone hear me now? Yes, perfect. Okay, so Benjamin Perez, and I'm a second year at UC Riverside. I was born in El Salvador originally, but I've been living in the US since 2013, and I've been working with underserved communities throughout my undergraduate career and now in medical school. Um, so for today's presentation, we are going to be focusing more on the Purepecha community in particular, which is a community of um, indigenous Latin American immigrants from the state of Michoacan, Mexico. But we will also be discussing some cultural topics that may apply to immigrants and non-immigrants from different cultural backgrounds. So, next slide, please. Yes, so today's presentation will be a little bit more focused on understanding the Purepecha community and culture in order to promote a more sensitive understanding of and connection with a culture that may differ greatly from our Western-dominated paradigms. Future presentations will delve deeper into honoring culture in treatment and services, as well as recognizing and understanding trauma that may accompany their lived experience. But today's objectives are understanding who the Purepecha are and how history informs their health and barriers they face today, recognizing how traditional beliefs may influence health-seeking behaviors, adherence to treatment, and overall views towards healthcare, and also identifying key specific cultural, social, and structural barriers to healthcare that Purepecha community members we have worked with have expressed to us in the past. Okay, next slide, please. Okay, so the Purepecha community, next one. So, as stated, the Purepecha community originates from the state of Michoacan, Mexico, and are a group of indigenous Latin Americans. In the US, they're also a part of the greater immigrant community that forms the immigrant community of the United States. Before the Spanish colonization of the Americas, their empire grew to be the second largest in Mesoamerica and was one of the only one to not be conquered by the Aztecs. So they were originally a network of tributary systems, but their empire became increasingly centralized, developing into a true territorial state with their capital located on the banks of Lake Pátzcuaro. This also led to a distinct and unique culture from other Mesoamerican groups. Notably, they were also among the few Mesoamerican groups to use metal for tools and weapons and showcased intricate and complex social and political dynamics. So after Mexico's independence, their deep knowledge of the land allowed them to develop sophisticated agroecological systems that helped them thrive. However, over time, land privatization, industrial logging, and multiple interventions disrupted their practice and weakened their local autonomy. So the Purepecha have had many changes to their culture, and as colonization introduced new religions and institutions, many of their traditional beliefs and practices were erased. However, despite the dominance of Catholicism, the Purepecha created their own unique spiritual identity that blends both traditional beliefs and Christian symbols. As such, the Purepecha people have a strong shared sense of unity and community that is marked by a desire to preserve their own unique traditions, identity, language, and practices. Next one, please. So, over generations, there have also been many shifts in their language practices as well. In present times, the Purepecha language remains common among elders, but Spanish dominates among younger speakers. While some are bilingual Purepecha Spanish speakers, a history of social and economic marginalization has led to many Purepecha having limited education opportunities and have only a limited level of reading and writing skills. Um, we have prepared a video that is going to be coming up in a couple of slides so that you can get a bit of a taste of the Purepecha language. And if you pay close attention, you'll also hear that there are some borrowed words that they use from Spanish. And that also brings us to our first very important implication for providers. That is that in the same way that they might need to borrow certain words to express themselves, um, they also feel much more at ease using Purepecha language to express certain nuanced emotions or maybe sometimes even symptoms. Even when a Purepecha patient speaks Spanish, a Spanish interpreter might just not be sufficient enough to allow the patient to express themselves properly. Next. I'm not sure we can hear that video, but maybe the next video we'll be able to hear.
Pamilya Ninguni Accident, Katatiko,
So this is a video showing
That Imagine was Estados Unidos.
Okay, so in modern times, in present times, the Purepecha are heavily affected still and threatened by political discrimination, lack of representation, violence, and corruption. And although there is an overall lack of development in the rural areas that they tend to inhabit, a history of colorism and anti-indigenous attitudes also magnifies all of these issues. Industrialization in general has also tended to greatly harm the agriculture they once thrived on post-independence, which has led them to migrate both within Mexico and the US. So on this slide, we can get a better understanding of the migration patterns of the Purepecha people across the United States. Migration patterns are also greatly influenced by their social networks and family connections, leading to formation of small communities. In many cases, chain migration is observed with a couple of foci forming in multiple states. As we can see, there are two big communities in California. Those are the main communities that we have studied, but there is also some communities in Washington State, in Pennsylvania, and in Florida. Ongoing economic inequality and limited access to resources at home has further fueled these migratory trends. Next one. Although it is likely that Purepecha people are present in other places within the US as well, five main communities have been identified. Of the five communities, the largest ones find themselves in the eastern Coachella Valley in California and in the Central Valley in California. These communities maintain deep ties to their traditions, language, and present with mutual support systems. They have maintained their collective identities, respect for their elders, and also a great desire to keep their traditions and language alive. In fact, in some of their cases, they have even asked for permission from the elders still in Michoacan to have some of the saints' statues to be delivered so that they can keep going with their religious and traditional beliefs. This just showcases how important it is for them to maintain their identity. However, they are also very disproportionately impacted by social and structural inequalities in health, which are greatly compounded by language and cultural barriers. Moreover, as a direct effect of colonialism and colorism, they are already a marginalized group in their own communities of origin in Mexico. So this pattern, when they move to the United States, is perpetuated and in some cases even amplified in their US communities. Next one. Now we will be watching a short video testimonial from a Purepecha community member from the Eastern Coachella Valley community. This is Antonia Quiroz Rafael, and she will tell us a bit about her experience and some of the barriers she faces alongside her community.
Me llamo Antonia Quiroz Rafael, de la comunidad de Opumicho, Michoacán, municipio de Charapan, México. Y champurempo ancuac no usan ses wanda en español, capurempo hi wanda. Kuche ishes te amasco ni te escuché ni retar. Engachma no anchicuariac. No chikawat par matiren o par mamayan pininden. Yaman beren, mashumayan pi. Rente rambe, Lucy rambe, Itri rambe. Malambe picuari rapi, que par wiri pane doctor y ningún gamayan picuari. Sino, himinto chikmender ma. Iso de comer kachma. Trabajos hatropinia ekma no kangoria aquí in the medical inambe ya. In the chikan cuestiano san shuan in the pureja. Uchasayami to san hucha. Haro persenge girsan. Shuchak shende puro filiris anji kwarsendea. Wen marok salas tenga ksani hardineriaris san acomodari kwari. Marok sagol horis. Hichan in the nimposeshanga enga ksende hini hospitalis corrideres atenderipi. Himbokshu clínique chimbo. No cuentes para ksrehes atenderi en engallas. No se explicualiran eran de pinca. Wanda ni hini. No terus atenderi parma iskmiran no akich happy en nani atenderi pinga ima kuriati que manos espikualiran happy kainga chnokan walia que troca nambeya o no manijari wa que o no neme ne ni wakpani nawe kichen no se espikualiran happy nani kanone me bari nira no hospital pani ima kuche no se espikualiran haramea san cesero canaria que pero no san par pinambe nani dismero no se spicoli o ave pa generali nani purux computador himbo kindean kune kanoksan papat pinien canari pin asus no se spic canisti te pingena kinde san ses tratari pineka inde jatsupe kimbo no shanari stanko kimbo kach color ma sharas gies kachangat pures que ide tsupe kimbo ochtun Cherry gambe ochtuniki que ambe ya kuchanzu na santa wena kinde tatak sapichu ban hini clínica lo vacunaris. Winish rent ma sala de espera clínica. Ki max atenderi. I isti tipinga no ya se que de wekan haka inde doctori gambe hupikania. Es que de cesas ma doctori ping.
Thank you. So many of these factors we're going to be speaking about right now in the following slides, but I just thought it was very important for us to hear straight up from a community member what they face, and also that we can hear exactly some of the barriers that they encounter when trying to get healthcare. So next slide, please. So now I would like to discuss some of the traditional health beliefs that inform part of their worldview and affect their health behaviors. You will notice that the discussion in the following slides is somewhat generalized for Hispanic populations as a whole. And while not all members of the community might express all of these specific beliefs, it is crucial to understand them as they absolutely inform many of the decisions that they take sometimes. Moreover, understanding the following traditional health beliefs can also help us as providers to reach across and better understand other marginalized communities, including both indigenous and non-indigenous communities as well. So we can go ahead now. The first thing I would like to talk about is the hot and cold theory. The hot and cold theory is this traditional health framework that sees the cause of illness and ailments as an imbalance between hot and cold forces within the body. So under this framework, healing focuses on addressing the imbalance through specific foods, remedies, and behaviors. So a great example comes from a study of Latina mothers in a California clinic, in which up to 80% of them attribute the cause of coughing and common colds to weather changes, walking barefoot, or consuming cold beverages. In many cases, they tend to try to correct this imbalance and may believe that many of these things actually are the causative agent of disease. Next one. Another common topic is el susto. El susto, it can be translated to English as the scare or the shock, and it is an understanding of illness stemming from a sudden fright or emotional event that is believed to disturb a person's spirit and causing symptoms such as sadness, anxiety, fatigue, and loss of appetite. Now, while el susto can refer to specific folk illness or a culture-bound phenomenon, specifically el susto, it with the specific aforementioned symptoms, many chronic conditions like type 2 diabetes are sometimes explained to have originated from a traumatic event as well. Under this framework, emotional disturbances can be seen as very strong factors influencing pathogenesis, and it's very important to take them into account as well. El mal de ojo. Now, el mal de ojo can be directly translated as the evil eye, and it is a belief that a person can cause harm, discomfort, or physical ailments through an envious or intense gaze. Children are thought to be particularly affected by it. Now, sometimes this can be caused unintentionally, but it can also be seen in the form of someone cursing or hexing another person, leading them to become sick and express symptoms such as irritability, crying, diarrhea, and aches. Um, the symptoms of mal de ojo may overlap with serious biomedical conditions as well, and can also be seen as a way of understanding the pathogenesis of disease and attributing a reason as to why these medical conditions are occurring. In many cases, the mal de ojo can be repelled by the use of amulets, sometimes called azabache, like in the case that we can see here on this picture, as a protective measure in the form of amulets and necklaces. The amulets themselves can also sometimes pose a real danger or injury of ingestion to a baby. So, a way in order, a possibly culturally sensitive alternative to this that a provider might recommend is to maybe pin the azabache amulet on the inside of a garment rather than having it directly on the baby to avoid injury. El empacho. El empacho is also a condition that is thought to happen due to a substance such as food being stuck to the insides of the organs and causes an obstruction leading to common GI symptoms such as diarrhea, constipation, stomach aches, and anorexia. Pediatricians note that el empacho might sometimes be used to explain conditions that may include gastroenteritis, food allergies, or even more chronic conditions or serious conditions such as appendicitis and pyloric stenosis. Um, Much attention needs to be placed on el empacho since parents may opt to bring their child to a curandero or sobador for a traditional healing or massage, which in some cases may actually delay treatment of very serious conditions. For example, in the case of appendicitis, that can be a very acute condition that can very fast turn into something more serious. They might opt to bring their child to a curandero and thus worsen the condition. Simpatia. Now, simpatia can be translated to kindness. It literally means sympathy. However, as a whole, politeness and pleasantness are expected in the face of stress, and it is greatly valued and emphasized. So, patients may expect their providers simply to display kindness in how they portray themselves. A lack of sympatia may also result in decreased satisfaction with care and lead to distrust from patients, which may lead to inaccurate medical history, lack of adherence or to care or follow-up. In fact, we also saw in the testimonial that that has led to a little bit of hesitancy from some community members as well. Now, for personalismo, personalismo can be thought of as a formal friendliness. Patients may expect personalismo or a formal friendliness from their providers in the form of a warm, cordial, and personal relationship with them. That is the key, that they expect the relationship to be personal with their doctors and other providers. In some cases, it may also be expressed by certain gestures and physical contact, such as handshakes, a hand on the shoulder, or even a small hug in certain circumstances. It is hugely important to show personalismo and formal friendliness when dealing with purepecha patients and also any other patient as a whole. Thank you. Respeto. Respeto means respect in English. And it is important to note that patients see providers as authority figures who must be shown respect, but also from whom respect is expected as well. Respeto is a two-way street. However, having said that, older patients may also expect a heightened degree of respeto from their providers if their provider is significantly younger than them. This is something that needs to be taken into account as well and just gauged with the patient and the particular conditions. Thank you. Familismo. This is a collective loyalty to the nuclear and extended family that tends to outrank the needs of an individual. In short, obligations to one's family are seen as much more important than personal obligations. Patients will take their family into consideration when taking medical decisions, but they will also expect their family to be there for them. It is also a two-way street, like respeto. In fact, it is also important for clinicians to acknowledge familismo by highlighting the role that family might play in a patient's healthcare and also including them in the conversation and in the healthcare plan. Not acknowledging familismo may inadvertently lead to unnecessary conflicts, non-adherence, and dissatisfaction with care as well. Lastly, I wanted to point out fatalismo, which is a particular belief that the individual can do little to alter their fate and that their fate is already predetermined. So, as an example, in a study of adult attitudes towards cancer, 46% of Latino patients expressed that cancer is a death sentence versus only 26% of whites. As a consequence of fatalismo, and patients believe that there is little they can do to alter their destiny, this may lead to them lacking adherence to care and also to be less present in preventative screening or even foregoing care altogether. If they feel like they're not in control of their health, then they would just leave it to the hands of destiny. One of the main ways in which a provider can address fatalismo is by emphasizing the importance of screening and prevention, and also underscoring the effectiveness and efficacy of medical therapies. Show that this is something that has been shown to help people in the past, and that a chronic disease is not necessarily a death sentence, and is something that can be overcome or at least managed with medications. Now we will be focusing more on specific healthcare barriers that the Purepecha community faces. And while these are more specific to Purepecha community, they may also apply to other marginalized populations. So it's still a very important conversation to have. Many of the barriers in the following slides are related to our team's work with the Purepecha community and draw on testimony from actual community members that have participated in multiple studies done by the Unidas por Salud team and many others. First, we're going to address some cultural barriers. The first thing that I would like to address is the gender norms and expectations. Generally, Purepecha women tend to be relegated to more traditional gender roles, such as taking care of the house or the kids. A strong presence of machismo is noted within the community, and in many cases, women have to depend on men financially and instrumentally. As we saw in the video, many of them do not drive, and sometimes they need someone to bring them to their appointments. Also, this leads to limited mobility and transportation opportunities. Traditional gender norms and expectations are of particular relevance to younger Purepecha women as well, who are encultured into the greater US culture. This enculturation tends to clash greatly with the gender expectations that the communities sometimes place on them. For example, young Purepecha women that have grown in the US have adopted more US-based models of womanhood and marriage and face great internal conflict and mental health strain when faced with the traditional gender norms that are expected from them. Another issue that arises from limited provider another issue that arises, sorry, is limited provider understanding of certain indigenous customs and relationship practices. For example, there is a traditional practice of a staged slash simulated kidnapping of girls of marrying age and grooms subsequently asking for forgiveness, a tradition commonly known as el perdón. They ask for forgiveness to the girl's family and then go into more formal marriage negotiations. Now, these, so to speak, abductions, they're mostly ceremonial and consensual, and are very distinct from the non-consensual bride kidnapping and forced marriages that happen in some cultures. However, providers in the United States tend to have a very difficult time understanding these specific nuances, and limited provider understanding may lead to Puripecha community members simply not sharing their experiences that in some cases might be a little bit traumatic due to the cultural differences. There is also very stigmatizing views around mental health. Um, Sorry, can we go back to the slide? Thank you. One before? Thank you. Right there. So, um, some of the stigmatizing attitudes towards mental health within the community lead to shaming and fear of judgment that discourage disclosure of medical conditions and help-seeking behaviors. In many cases, Purepecha people prefer to suffer in silence rather than ask for help. There is also a limited understanding of what mental health means as a whole. Even with reported mental health symptoms, there still exists a lack of awareness of mental health conditions and how they may manifest and what may influence mental health. Additionally, there is also a lack of awareness of how interventions such as therapy can help with trauma and mental health conditions. In some cases, this may also be compounded by practices such as familismo, by thinking that the mental health needs of the individual, um, they are simply outranked by the family needs, and they simply choose to forego care to not be a burden in some cases. Thank you. Next slide. There is also some social barriers to healthcare that we would like to address. One of the main ones is actually a distrust in medical providers. There is a lingering hesitation around accessing healthcare services amongst the Purepecha community. This particular distrust has been reinforced by negative experiences when accessing healthcare. There have been multiple reports of mistreatment and disrespect during clinical visits or lab procedures. In one instance, a patient reported being left heavily bruised after having blood taken for analysis. We have also heard reports of community members having been judged by their providers and treated as if they're just faking their illnesses or paying for insurance purposes or to get some kind of unemployment benefit. They have, in fact, sometimes even been told directly that that is what they're doing, which has led to very negative experiences that have then spread through the community through word of mouth. There is also language and communication barriers. As we mentioned previously, many Purepecha individuals are monolingual Purepecha speakers. However, even if they speak Spanish, clinics in their area sometimes don't have Spanish-speaking providers, which forces Purepecha community members to drive long distances to access healthcare in Spanish, or just do telemedicine appointments. There are many reports of patients not properly understanding their illnesses and even foregoing care as a whole due to lack of services in their language. In one specific case, we heard from a mother whose adult daughter had recently suffered a psychotic episode, but her limited Spanish proficiency left her unable to properly understand what was happening to her adult daughter and to help her through this situation. There are also some structural barriers that need to be taken into account. As we mentioned before, the Purepecha community is already a marginalized community within their own countries. However, due to a history of colorism, racism, and many other structural inequalities. This can be compounded when they move to the United States. As such, they have a limited formal education, specifically among older generations, and there is also very low health literacy, which affects engagement with the healthcare system. This involves including not understanding medical instructions or sometimes how to navigate online portals and even filling out forms accurately. In some cases, these forms sometimes are not even in Spanish and even less in Purepecha, which makes the problem even worse. There is also economic and employment constraints. There is a huge concentration of low-wage, physically demanding jobs such as agriculture, construction, and service. They work in very demanding jobs with very low pay, And in many cases, they have inflexible schedules and lack of employer-provided insurance. They also face some legal and systemic exclusions. Due to their mixed immigration status, they might have limited eligibility for subsidies and services, and some may also fall just above the poverty thresholds to receive subsidies, but still not be able to afford care as a whole. Also, there is a big fear of leaving the home community due to immigration status that hugely prevents clinic visits and makes people forego care as a whole. Thank you. Now we have also the Unidas por Salud team has also made visits to these communities, and in the following slides we will see a little bit more of the concerns that these communities had expressed. So in particular, there has been a huge discussion around mental health. And as we stated before, there are stigmatizing attitudes and hesitancy. There is during these community visits, the listening sessions were held in order to hear what the community had to say. However, due to the stigmatizing attitudes and hesitancy, the listening sessions had to be started with a general health approach before transitioning towards mental health due to stigmatizing attitudes regarding mental health. So it's a little bit difficult to approach the subject with Purepecha community members sometimes. Hesitancy to discuss mental health is also accompanied by an attitude of keep it to yourself, compounded by a lack of providers and culturally sensitive services. However, there is also a great recognition of the need for mental health in the community, and the community remains hugely open to collaborations to improve access and treatment. This provides a great silver lining as it shows that despite some stigmatizing attitudes that they might have, they actually are very willing to undergo mental health treatment and also to be informed about other services that might be available to them. Amongst the reported mental health concerns that we have heard are depression, particularly among the youth. There's also high levels of anxiety reported and suicidal ideation and even acts. And there are also many traumatic experiences related to immigration and mistreatment from employers leading to increased stress levels. Many of these topics, we're just introducing them here, but in the coming provider series, you will be hearing more about how they can be addressed in treatment services and also how they can be better understood. So now I would just like to ask of you um, if you have any questions, and also in our next slide, we have we have a quick question that we would like you to ask. Maybe if you can share it on the chat or you can unmute or something. Just in general, after hearing this presentation, can you think of some ways in which you can keep providing the high quality care that you provide for your patients while still taking their culture into account? Just opening the floor for questions or suggestions.